Laurene from Lewes wrote me expressing her disagreement with the Supreme Court's recent decision upholding the Affordable Care Act and its individual mandate as being constitutional. She's afraid that the law will ultimately increase her health insurance costs. Laurene, thanks for contacting me about this important and difficult issue. The Affordable Care Act, in my view, will end up having real economic benefits for Delawareans. We'll no longer have to worry about things like lifetime coverage limits or being denied insurance coverage because of pre-existing conditions. And nearly 120,000 Delawareans have already received free preventive care services because of the Affordable Care Act. For the first time, insurance companies now also have to reveal how much of their premium dollars they actually spend on health care and how much they spend on administrative expenses. It is my very real hope, Laurene, that the Affordable Care Act will end up reducing health care premiums and making our health care insurance system more accessible, more fair, and more sustainable for all Americans. Double-digit annual increases in health care costs have been a tremendous drag on our economy for the private sector and the public sector. And folks whose responsibility it is to care for our citizens, the American Medical Association that represents doctors, and the American Nursing Association that represents nurses, and the Hospital Association and the AARP that advocate for our senior citizens, all endorsed and supported this bill as the best chance we've got at reducing long-term our health care costs. I share your concerns about it, and I will carefully monitor its implementation to try and make sure that it doesn't increase health care costs for Delawareans. Laurene, thanks for contacting me about this important issue.